Parkinson's disease case study. Bill Atlas's case. Bill Atlas is a 70-year-old male who was diagnosed with Parkinson's 3 years ago. This disease affects motor areas of the brain, causing slowed movements, tremor of the hands, and gait disturbances. Parkinson's is a progressive disease and contributes to the early death of victims. A physical examination reveals Mr. Atlas experiences difficulty walking, ataxia, bilateral action tremor, and resting tremor. Mr. Atlas lives with his wife, who is in good health. He goes to physical therapy once a week. He takes levodopa and cardiopa. Parkinson's disease affects each individual in different ways, and all of the symptoms of Parkinson's are not experienced by everyone. There are a couple of different stages, and stage 1, in the beginning of this stage, the symptoms are mild and do not necessarily restrict daily activities. Tremors and other movement symptoms can start to take place on one side of the body only. Other symptoms that happen are changes in posture, walking, and facial expressions. In stage 2, the symptoms begin to get worse. Both sides of the body start to experience tremor, rigidity, and other movement symptoms. Visible walking problems and poor posture. Individuals are still independent, but daily tasks start to get more difficult. In stage 3, this stage is thought out to be the mid stage. Slowness of movements and loss of balance begin. Individuals are at higher risk of falls. Symptoms can start to impact certain activities such as dressing and eating, but the individual is still independent. Stage 4, during this stage, the symptoms are limiting and severe. Although it is possible for the individuals to stand on their own, a walker may be needed for movement. Help is definitely needed with daily activities, and the person is no longer able to live alone. In stage 5, this stage is the most advanced stage. It may become impossible to walk or stand due to stiffness of the legs. A wheelchair or being bedridden would be required for the individuals. They can no longer be independent, and a caretaker is needed around the clock. Hallucinations and delusions may be experienced.
How is Parkinson's diagnosed? When doctors diagnose someone with Parkinson's, they look at the patient's medical history, their symptoms, and they take a neurological exam. There aren't any existing tests that can diagnose someone specifically with Parkinson's. But when doctors are examining their patients, they look for certain symptoms. The symptoms are tremors in the hands, arms, legs, head, or jaw, stiffness in the limbs, and rigid muscles. Bradykinesia is when the body is experiencing slowness of movement, stoop posture, loss of balance, and coordination. And dystonia, which is when someone is experiencing spasms, cramps, or even muscle twistings.
Medications the patient is on. Mr. Atlas is currently taking a pill that is a combination of carbidopa and levodopa. They're both used to treat Parkinson's disease. Specifically, levodopa treats stiffness and slow movements and tremors, and carbidopa treats spasms and poor muscle control. Now I will explain a little bit about the mechanisms of action of levodopa in the brain. Levodopa is absorbed by the cells in your brain and is turned into the chemical dopamine, which is used to transmit messages between the parts of the brain and nerves that control movement. Levodopa is a decarboxylated to dopamine and stimulated to the dopaminergic receptors. Possible treatments that you could go through. So Bill goes to physical therapy once a week to improve his cardiovascular health. He also takes medication to help regulate tremors, stiffness, and slow movements. Although these treatments may improve symptoms, there is no cure for Parkinson's. Patients with Parkinson's need to be monitored in case they fall because this is a major cause of death with patients with the disease.
Someone who has Parkinson's is experiencing decay in the brain as neurotransmitters are becoming impaired. For an example, inside of the brain, the basal ganglia nerve cells are impaired and they're dying. The regions of the brain that are becoming affected from the disease is the motor cortex, which is why someone experiences stoop posture and a loss of balance and coordination. The globus pallidus and the caudate nucleus and putamen regions are experiencing loss of dopamine. And the striatum experiences loss of its dopamine neurons, and the striatum projection system is being disrupted when responding to the cortical and thylamine signals. The degeneration and death of dopamine and neurons from the brainstem is in the substantia nigra region. Other regions that are affected because of dying neurons is the amygdala, hypothalamus, locus ceruleus, and the raphe nuclei.
So this is the pathophysiology of the disorder. Certain nerve cells or neurons in the brain gradually break down or die. Many of the symptoms are due to a loss of neurons that produce a chemical messenger in your brain called dopamine. The decrease of dopamine happens mainly in the part of the substantia nigra called the pars compacta. The loss of dopamine in the pars compacta increases the overall excitatory drive in the basal ganglia, disrupting voluntary motor control and causing the characteristic symptoms of Parkinson's disease. There are several proposed mechanisms for neuronal death in PD, however, not all of them are well understood. So here are two diagrams depicting a visual representation of where these structures are in the brain. The one on the left-hand side shows a median view of the brain, pointing out where the dopamine pathway and the substantia nigra are. The picture on the right-hand side depicts a transverse view of the brain, specifically showing the difference of a person with and without Parkinson's disease. A large difference being on each of the substantia nigra. A one with non-Parkinson's would be a more rigid looking substantia nigra, while one with Parkinson's is more of a smoother appearance. In conclusion, Bill Atlas displays all of the symptoms of the progression of Parkinson's disease as he was diagnosed 3 years ago. As there is no cure for PD, the best way to combat this disorder is to simply use medications and therapy to ease the symptoms. We would want to do some further research on any family history since there is a small possibility it could have been inherited, and also look into the current research on the progression for a cure for Parkinson's disease.